Out with the old, in with the new. It's been 10 years since we launched the first Cassini. Since then, our dedication to innovation and our consistent progression, together with our vision care partners, has been described as historic, and there's a lot more to come. We recently reached out to some of our valued founding surgeons to learn more about the transition from their first edition devices to the ever-evolving Cassini Ambient. Here's what Dr. William Trattler says about it.
I'm Bill Trattler from Miami, Florida. I'm at the Center for Excellence in Eye Care. We're a group of both ophthalmologists and optometrists, and my focus is in cataract, cornea, and refractive surgery. I feel very fortunate I'm part of a wonderful group of ophthalmologists that really have an important focus on trying to optimize and get the very best visual outcomes for patients undergoing cataract surgery. And I'm sure many of my colleagues across the country and internationally feel the same way. We really want our patients to have a great result. And what we found is that the Cassini has always been so helpful in getting the best results because it helps us measure astigmatism, both interior astigmatism and total corneal astigmatism. The latest generation technology has helped because it makes it easier for patients to get good results because the light intensity is reduced by 70%. So it's just more comfortable for patients. They're able to keep their eyes open. Those that are a little more photosensitive can still get a great image. So it really makes it easier for our patients. The user interface has helped as well, from my understanding from our technicians, making it also easier for them to capture patients and do all the testing. Another big enhancement for the latest technology is the improvement in the iris camera. One of the important parts in our practice is to get beautiful images of the iris and import them into our laser, which is the LENSR laser, to allow for iris registration during the procedure so that if a patient's head is slightly tilted, we'll still get a beautiful result. And what happens is by having a very high definition iris image, the iris registration can work very precisely and allows us to, again, identify the correct astigmatism axis, and therefore with the LENSR laser, mark the astigmatism axis for our toric lenses or for those doing femto AKs, making sure those are correctly on axis. So we feel very lucky that the next generation Cassini has been available at our center for over a year. We've had a great experience with it. We have multiple surgeons using it, and it's worked very beautifully. One of the new features I love about the Cassini Ambient is that it takes an instantaneous image of the cornea and allows for a very rapid image so that we get very accurate readings of the interior corneal power and the total corneal power, so we can measure the astigmatism. And that's critical because in our practice, we have 7 cataract surgeons that are all working together to try to get the very best visual outcomes for their patients. And the way to do that in our patients undergoing cataract surgery and refractive lens exchange surgery is to understand the level of astigmatism and the axis of astigmatism. And being able to measure accurately the total corneal power is really critical to that. So in our practice, we are utilizing multifocal intraocular lenses, toric intraocular lenses, all different types of range of vision lenses. And again, understanding the total corneal power is critical. And so since we added in the next generation Cassini, the Cassini Ambient, our accuracy readings feel that they've gone up because, again, we're getting a very accurate reading of the total corneal power. My technicians have shared with us that it's very quick to get nice, accurate measurements, which is really helpful for our practice flow. We have a large practice with multiple patients rolling through our office, both seeing us as physicians, but also going through our testing center, and being able to make it easy for our technicians to get accurate readings is really critical to the whole workflow in our practice. So that is one very nice feature of this next generation Cassini Ambient. We have had access to the Cassini for the past 7 years, and it's paired up with our LENSR laser in our surgery center. And this really made our workflow really easy for us as surgeons, as we really want to do our very best to correct astigmatism during the time of cataract surgery. In the past year, we've added in the Cassini Ambient, making this an even easier and more accurate system. Basically, what happens is, after patients have been captured in our office, the information is transferred to our laser, the LENSR laser, and during cataract surgery, what we're doing is we're first doing a laser treatment where the information has been imported from the Cassini into the laser, and the laser is able to perform iris registration, mark the axis of astigmatism on both the capsule and the cornea, so that when I actually get into cataract surgery and I've taken out the cataract and I'm ready to put my intraocular lens in and figure out where to orient my toric part of the lens, it's very simple and easy as a surgeon because I just line it up. So it's really made it easy for me as a surgeon. There's no preoperative marking needed, and my life has worked out very nicely. I'm also able to check after cataract surgery, a week later, a month later, dilate the patient and see to make sure that the lens has remained in the right axis if there's any questions or concerns. So overall, it's been a great system. It makes life easy as a surgeon, and it really helps deliver fantastic outcomes for our patients.
The easy and seamless upgrade to Cassini Ambient's revolutionary digital vision care platform can raise the bar in your diagnostics and surgical outcomes too. Contact us and let's give your cataract practice the speed, efficiency, and accuracy it deserves. Cassini, the world in vision.